Hello, future doctors. How are you all? Welcome back to MedSteps YouTube channel. So today we are going to discuss very important high-yield lab test, that is cerebral spinal fluid interpretation. So most commonly, this is the lab report we can see in our clinical departments. So that time we have to know how to interpret it. As a student, we have to know the pathological condition and how to interpret it. So that's why today we are going to discuss this topic. Many students ask me in Telegram, so that's why I'm making these videos about this clinical skills and lab interpretations. So let me ask you something before starting video. It's very important. For example, a patient comes with fever, headache, neck stiffness, or altered sensorium or altered mental status. What is the one investigation that can immediately change your diagnosis? It's cerebral spinal fluid analysis. So today we are going to discuss the topic. So we are going to discuss cerebral spinal fluid interpretation in a very simple, pattern based and exam oriented way, so that you can diagnose meningitis within seconds in your exams and in your real life. Okay, so let's start. First of all, we can see cerebral spinal fluid interpretation, basic to advanced. So what is cerebral spinal fluid? So or CSF. CSF is a clear fluid that surrounds the brain and spinal cord. Its main job, what the main function of CSF means, it will protect. So protection and nutrition for brain and waste removal. But clinically, CSF is even more important because it reflects what is happening inside the brain and the meninges layers. So, before interpreting, we have to know normal cerebral spinal fluid values. So, if you're seeing here, this is normal cerebral spinal fluid values. Before interpreting this is, we must know normal CSF. So, if you're seeing here, this is opening pressure. So, the opening pressure 60 to 180 mm H2O. And appearance, you can see here, it will be like clear and colorless. And WBC 0 to 5 cells, and red blood cells you can see 0 to 2 cells, and proteins 15 to 45 milligram per deciliter. In glucose 50 to 80 milligram per deciliter. And along with that, in glucose, one important thing, 2 by 3 of serum glucose we can see. And next we can see that is chloride. The chloride will be like 118 to 132 milli equal per liter. So if you know normal values, you can easily find out the abnormal things. Okay, so that's why this is very important. Now, how to approach the cerebral spinal fluid interpretation? How to do? When you see a CSF report, never read randomly. So always follow the 5 steps approach, because whenever I'm doing any CSF interpretation, I will follow this 5 steps to interpret it. So it will help to diagnose properly. So here first we can see we have to look appearance, how the fluid is looking. Then after opening pressure. So this is the first thing we have to look. Next we have to see the count of red blood cells and white blood cells and some differentials. Next we can see we have to check protein, glucose and chloride. Next we have to correlate with our clinical picture or clinical symptoms, and if patient have any imaging if available, we have to correlate with other tests or clinical examination, and this another lab test or imaging and everything we have to correlate. So at last we have to give final diagnosis, that is most likely diagnosis, like final conclusion. Okay, so these are the first 5 steps we have to follow for interpreting cerebral spinal fluid. So next we can see here, I will give some tips to find out about this cerebral spinal fluid interpretation. Okay, so if you're seeing here, you can see always, first of all, we have to correlate clinically. Then after we have to interpret glucose with serum glucose, and we can see high red blood cells with decreasing and red blood cells in successive tubes like traumatic tap. Next, we can see high red blood cells with persistent, and whenever you are seeing red blood cells, we have to think pathological, and cells with protein. If greater than 1, we have to think, if proteins are greater than 1, we have to think tuberculosis or fungal or carcinomatous. If in doubt, we have to repeat our lumbar puncture or we have to add additional tests. Okay, so these are the main CSF patterns we have. So these are things very important. If you know how to interpret these things, if you know that normal values, then easily you can differentiate it's bacterial or viral or tuberculous or fungal, or if patient have any subarachnoid hemorrhage or Guillain-Barré syndrome or carcinomatous meningitis. So these are the different types, like it's advanced level we are going to discuss now. Now let's learn pattern recognition. So first of all, we can see here, whenever you are seeing CSF interpretation, we can see opening pressure, appearance, and white blood cells, and white blood cells differential, and RBC count, protein, glucose, chloride, and some key points, means symptoms, clinical features. So if you're seeing here, first we can see that is bacterial meningitis. So in bacterial meningitis, it's very important emergency condition. So if we are suspecting bacterial meningitis, in CSF reports, we can see like the opening pressure will increase. So if you're seeing a normal case, the opening pressure will be like 60 to 180 mmH2O. But here what will happen in bacterial meningitis, the opening pressure will increase. And the appearance, you can see turbid and cloudy. Okay, if you're seeing any CSF is like turbid and cloudy, you can suspect patient have bacterial meningitis. And the WBC count will increase like 100 to 10,000, more than 10,000. So in cells, you can see neutrophil predominant. In RBC count, if you can see here, the RBC count will be like 0 to 2 usually. So the proteins will be like high, like greater than 100. And the glucose will be like low, because you can remember this thing, because in bacterial meningitis the glucose will become low, like less than 40% of serum, and the chloride will reduce. Okay, so if neutrophils and low glucose, we have to suspect bacterial meningitis until proven otherwise, other medical condition. So in key points, we can see acute onset and fever, neck stiffness, and urgent treatment needed for bacterial meningitis. So next we can see here that is viral meningitis. In viral meningitis, we can see here the opening pressure is not like bacterial. The opening pressure will be like in viral meningitis, the opening pressure will be like normal or to mildly it elevated. And the appearance, if you're seeing, means it will be like clear, and the WBC will be like 10 to 1000. And in viral, you can't see neutrophils, you can see predominant lymphocytes. Along with that, the protein will be like we can see 0 to 2. Along with that, we can see the glucose will be like normal to mild. Okay, along with that, the chloride will be like normal. Okay, so it will be like self limit lymphocyte dominant. So in that things, in that viral meningitis, we can see the clinical features will be like often self-limiting and aseptic picture. Okay, so these are the things. Next, you can see here that is tuberculous meningitis. So in tuberculous meningitis, the opening pressure will be like increased, and the appearance will be like clear and slightly and opalescent, and we can see the WBC will be like 50 to 500, and the cells will be like, we can see lymphocytes predominant, and we can see the protein will be like and the RBC will be like, you can see like 0 to 10, and the proteins, you can see it will be like the protein will increase in tuberculous meningitis, and it will increase more, and we can see 100 to 500, and the glucose will reduce. So the glucose will reduce, and less than 45 or less than 50% of serum. We can see along with that the chloride, it will reduce. So in key points, in clinical features, we can see that is chronic course or basal exudates. In tuberculosis patient, the patient will get cranial nerve palsy is the most common in tuberculosis meningitis. So next, another condition we can see that the thing, another pattern we can see, that is fungal meningitis. In fungal meningitis means it will be like similar to same like tuberculosis. You can compare here. The tuberculosis, the open pressure increased, and fungal also increased, and it will be like clearly slightly opalescent, and fungal also clear and slight opacent. And you can see here fungal meningitis mostly we can see in immunocompromised patients. So here we can see the 22,500. We can see along with that the lymphocytes increase. The lymphocytes will increase same to same like TB. Along with that, the RBC like 0 to 10 per 10 also you can see. Along with that, you can see that is glucose will reduce. Along with that, we can see the protein and the chloride will become less. Okay, the protein will be like more. It will be like high and 550 to 500. So the patient, you can see that is immunocompromised patients at risk. That is fungal meningitis. Next, you can see here that is subarachnoid hemorrhage. In subarachnoid hemorrhage, it's very important emergency diagnosis, because same to same it will like the subarachnoid hemorrhage, the opening pressure will increase, and we can see in xanthochromic we can see in appearance after few hours of the subarachnoid hemorrhage or traumatic incident. Next, we can see like that is 0 to 10, or it will be maybe it will increase the WBCs, and we can see that neutrophils will increase, and we can see like high or does not clear in successive tubes. Okay, and you can see here that is slightly the protein will slightly will increase, and the glucose will be like normal and chloride will be like normal. So the patient, if any patient has subarachnoid hemorrhage, we can say the patient will get a sudden severe headache. Okay, like sudden clap headache, the patient will get along with that RBC persistent in all tubes. Okay, so next we can see that is Guillain-Barré syndrome. In Guillain-Barré syndrome, if you are comparing with everything, you can see here in Guillain-Barré syndrome, in Guillain-Barré syndrome, the opening pressure will be like normal, and the appearance will be like clear, and the WBC count will be like 0 to 10. Along with that, you can see normal cells, and if you're seeing here, the protein will be like 0 to 2, and the glucose will be like more. It will be like high, along with the greater than 45, often 100 to 200, and we can see glucose that is normal, and chloride will be like normal. So here you can see that is the key points will be like albuminocytologic dissociation and high protein normal cells. So if patient getting any like problem with muscle movements and everything, we have to suspect Guillain-Barré syndrome. So this is the thing. So in Guillain-Barré syndrome, we can see open pressure will be like normal, and WBC will be like normal. The protein is the main thing will increase more. You can see here, the protein will increase more, and the glucose will be like normal. Okay. So albuminocytologic dissociation means it's like high protein in normal cells. Next, at last, we can see that is carcinomatous meningitis. In carcinomatous meningitis, we can see the opening pressure will increase, and the appearance will be like clear and slightly opalescent, and the cells you can see 10 to 500, and the WBC will be like lymphocytes predominant, same to same like viral meningitis. Okay, and here you can see that is 0 to 10 cells, and the protein will be like more high, 50 to 500 plus. Okay, and the glucose will be like very low, and maybe it will becomes normal, and chloride will be like low. Okay, so this is atypical malignant cells with maybe present. So history of malignancy or may have atypical cells on cytology. Okay, so always we have to compare with our RBC interpretation. So now how to differentiate traumatic tap versus pathologic? How to do means, first one we can see here traumatic. In traumatic interpretation, RBC interpretation, you can see here the RBC, the red blood cell count decrease in successive tubes. Next, pathologic will be like RBC counts will become persists in all tubes. Okay, next, this is the main classical exam question the doctor can ask. So how to differentiate means the traumatic tap means the RBC will decrease in while collecting the tubes. In pathologic, if for example the patient has subarachnoid hemorrhage, so the patient will, you can see RBC will remain same in all tubes. For example, xanthochromia, subarachnoid hemorrhage until proven otherwise visible after 12 hours. Okay, so this is the classical exam in ASCII station the doctor can ask you. So next we can see here, that is red flags. In this red flags, we can see always we have to think serious when we are saying CSF interpretation. If patient have very low glucose and high protein means, always remember, because very low glucose and high protein means we have to suspect patient have bacterial, fungal and tuberculosis meningitis. Okay, so this is the main important point. If you are seeing very high protein, then you have to suspect Guillain-Barré syndrome or tuberculosis or carcinomatosis. If you are seeing any xanthochromia, then we have to suspect patient have subarachnoid hemorrhage. History of subarachnoid hemorrhage or subarachnoid hemorrhage. Very high opening pressure is there means, that means you have to understand patient have increased raised intracranial pressure. Next we can see atypical cells. If you are seeing means that time we have to suspect patient have atypical cells means malignancy. So we have some formulas and rules for interpreting cerebrospinal fluid. If cerebrospinal fluid by serum glucose ratio, if normal are greater than equal to, normal will be greater than equal to 0.6. If the CSF and serum protein ratio normally will be like less than 0.5. The cells and protein rules. If the WBC protein is high, we have to think the patient have tuberculosis meningitis or fungal meningitis or carcinomatous meningitis. So in final end exam point of view, let me simplify the cerebrospinal fluid for your exams. That is, if neutrophils increased in WBC cells means we have to suspect patient have bacterial infection. If it's lymphocytes means we have to suspect patient have like viral or TB or fungal meningitis. If patient have like low glucose, we have to suspect patient like bacterial and TB meningitis and fungal meningitis. In high protein, we have to suspect TB meningitis or Guillain-Barré syndrome or carcinomatous meningitis. If you are seeing xanthochromia, cerebrospinal fluid, we have to suspect subarachnoid hemorrhage. If you remember this, you can solve 90% of cerebrospinal fluid questions instantly. Okay, so next time, if you are seeing cerebrospinal fluid report, don't get panic. Just relax. Just follow the pattern. First we have to look, then after we have to count, then after we have to check, then after we have to correlate with another test. At last we have to give conclusion, means we have to give diagnosis. And you will become confident in diagnosing meningitis like a experienced doctor. Okay, so we will meet in our next clinical skills lab interpretation lecture. So till the time, I'm signing off. If you didn't subscribe my channel, like, share and subscribe. If you have any doubt, you can ask me in comment section. We will meet in our next video. Till the time, take care. Bye bye.